back. We're going to talk today about the largest clinical trial of alcoholism treatment ever conducted in the United States. Covered 8 years, cost about $50 million, and involved most of the major researchers, alcoholism treatment researchers in the United States. Project Match. Project Match was specifically about alcoholism treatment. And it came around in the 80s after the big fight about controlled drinking, and there was a real retreat. And so there was a movement partly, and involved Bill Miller, who was kind of a controlled drinking researcher, saying, well, maybe different treatments are better for different people.
Right.
If you could identify, like some people AA is perfect for, and other people, well, training skills or motivational approaches are better for.
I did understand that. Yeah.
So if we can just match everything up and get the right people and the right treatment, Bob's your uncle. Well,
it's like people now say there's a hashtag on social media, many paths. It's like the most nebulous thing you could say. It's like it's basically nothing. It's saying, well, just whatever works for you, just do that.
But it's more than that.
This is more than that. But
Paul was saying we're going to be able to figure out which thing is better for you.
Right.
Because we're going to have objective. They threw in a bunch of personality measures in this study. And then they were going to be able to say, well, if you're very literal, or,
I remember one was if you're an angry type of person who is trying to recover from an alcohol problem, you'd be better with motivational interviewing.
Right.
That's right. Yeah.
So I want to give some deep background. There were in the 1970s and 80s, there were a bunch of cognitive approaches to alcoholism, and I identified them with 4 people. And one of them is crucial to Project Match. Alan Marlatt in the 70s came up with the think drink effect, where people who are gamma, so-called alcoholics, you can't do this research anymore, were brought into a laboratory and they were given a highly flavored drink, and they were told that it contained alcohol or it didn't contain alcohol. And they drank more when they believed it contained alcohol, whether or not it did contain alcohol. So that's a kind of a non-diseasey cognitive outcome thing. Nick Heather came along in the early 80s also after that, and he came up with 2 things: a cultural delusion of alcoholics. People in treatment who believed that they had one drink were likely to relapse, were more likely to behave that way, A, and then B, developed a subjective measure of dependence versus an objective measure of alcohol dependence. And the subjective measure of dependence predicted better a course of a person's treatment and ongoing alcoholism than the objective measure. Then Jim Morford did a study where he compared putting people in based on objective versus subjective into a controlled drinking or an abstinence model. And their subjective view of themselves was more important in the outcome than the objective measure. And then finally, Bill Miller did it was published in the 1990s, did a study of outcomes of alcohol problem treatment. They weren't all alcoholics. And he found the best predictors of relapse were 2 things: lack of coping skills and belief in the disease model of alcoholism, which is kind of a radical thing. Believing in the disease model of alcoholism predicted relapse following treatment. So let's jump ahead, because Bill Miller is the main organizing force in Project Match. Remember, one of the concepts is, well, if you think in a diseasey way, well, then maybe AA is the best way for you. Is there any downside? Is there any downside to that in terms of what Miller's research said?
Is there any downside to what Miller is saying? I mean, That could be two
Downside to
questions.
the idea of saying, well, if you believe in the disease theory, that's the kind of treatment we'll give you. Based
right.
on,
If that's what you believe in, then that's the treatment we'll give you.
yeah.
Right. Well, yeah. I mean, the way, of course, I initially think about that is, if you believe you're diseased, you kind of are. So
That's what Miller found.
Can you take a step back, and is there any way that you can take a different perspective here? Because it seems like based on what you believe, you're going to land in that camp. Is there a way to be mindful and think about this in another way? Right. That would be the issue.
Exactly. And Marlatt, Heather, Orford, Miller sort of all found that your beliefs oriented your outcomes. Meanwhile, I mean, Project Match was begun in 1989. Bill Miller was developing something. There were 3 treatments in Project Match: skills training, 12 steps, and motivational enhancement. And Miller was developing motivational interviewing. Is there anything about motivational interviewing that would contradict the whole Project Match organization?
Yeah, you decide in motivational interviewing, you realize what kind of a person you are and where you want to go, as opposed to this is your personality type. Let me plug you into this treatment, which seems to be effective for you.
Exactly right. It seems to be a fundamental contradiction in Bill Miller's career that he said, why don't we do objective measures of who people are, and then we'll tell them what treatment they get? Where in motivational enhancement, you sort of say, well, what do you feel works best for you? Where are your values? You just follow their lead. And in particular, when Bill Miller made a list of the ingredients in motivational enhancement.
Oh, sorry. I just have to, but this is bundled into what you're saying, but just for anybody who isn't thinking this way, part of motivational interviewing or motivational is also helping people bring to surface contradictions in what they may be saying. You've said this and also this. How do you reconcile that? I think that's a crucial element of the reason why motivational interviewing contradicts the study of which works best for you based on your personality. Sorry to interrupt.
No, thank you. So you might say to somebody we've mentioned, we've talked about Matthew Perry and many other people who have had 12 or 15 bouts of rehab. And the question you might say is there something about what you're doing in rehab and what you're learning and what you believe that's not working for you? That's the kind of thing we'd like to bring them face to face with. And the last thing, motivational enhancement, Bill Miller calls it motivational interviewing. In Project Match, they had skills training, 12-step, and motivational enhancement. It's self-efficacy is the bottom line, which is, you're going to have to do this and figure it out on your own. So Project Match was an unbelievable, dare I use the word boondoggle. It was originally budgeted for $27 million. That's a lot of money. And it eventually cost over $40 million. It was a project that began in the late 1980s. It went on for 8 years. It had 1,726 subjects, highly selected, and eventually 459 didn't participate. And they picked subjects who were socially stable, and then 459 dropped out, which is another way of saying all of the subjects were mainly alcohol dependent, were volunteers. They were given 3 types of treatments that lasted 12 weeks, except motivational enhancement was only designed for 4 weeks. They were measured every 3 months for 18 months and then for 3 years. And there are 2 main measures: days abstinent and drinks per day on the days that they drank. It was the most highly trained kind of a procedure you could imagine. They developed manuals for all 3 treatments. By the way, the head of the NIIII, little something from my memoir. There were manuals for the 3 treatments. I got my manuals from the head of the NIIIA, Enoch Gordis, while I was in the waiting room, waiting to speak to the Queen of the Netherlands. Just a little tidbit from my fascinating life. And every therapist was trained. They even had a manual for the 12 steps. Every therapist was trained. They videotaped every single session. And, you know, you're not going to get treatment like this in the United States of America. So let me jump to the end of this over $40 million, dare I call it a boondoggle. There were no significant matches. They measured people with all these traits, and then they said, well, which one really works well with which treatment? And this was a period following the Sobels and the Pendery blow up, where you weren't allowed to do abstinence, where you weren't allowed to do controlled drinking. But they were at the bottom line that they came out with at the end, Gordis and a man named Richard Longabow, and the NIAAA representatives. So all of the treatments worked. They reduced their drinking from 25 days to 6 days. We didn't even know you were allowed to do controlled drinking. They didn't find any differences according to one treatment versus another, but they found that some sites, treatment was spread around the country, were much more successful than others. What does that suggest to you when you hear that the characteristics of the treatment place was important in outcomes, although the kind of treatment wasn't? What does that suggest?
The experience and the connection of the people, how people are presenting the manual, how people's interaction in the process is what determines.
And some of the people were better at it. That's just the way life goes. And the traits of this was a highly selected group. So I wrote a conclusion of this. Bait and switch at Project Match. I'm just going to read what I wrote. The largest, statistically most powerful psychotherapy trial ever conducted of alcoholism, and also by far the most expensive, produced little new information. I want to jump ahead and say, people no longer talk about matching. They spent $40 million plus to say, screw all of this. It's not worth it. We didn't really come up with anything.
Although our buddy, Maya Salovitz, in 2017, wrote an article about the promising new studies going on in Montreal by I forget the psychologist's name, who was tasked with figuring out personality styles of kids who might be the more likely to use drugs. So it's a concept that still people love to think about.
Of course, that's kids and drugs. It's
sure,
a little different than magic treatment, but
yeah,
that is going on. Research limitations. It was a highly selected client population, unusually high level of quality control of treatment. Make generalizations of these results dubious. The overall effect of being part of Project Match, this is a quote from the Project Match research team at the end of 8 years, with extensive assessment, attractive treatments, and aggressive follow-up may have minimized naturally occurring variability among treatment modalities. In other words, if you do all of those things, select people, have the best trained people, do the most follow-up, they're going to have good outcomes, no matter what you do for them. The principal result of the study was the modest treatment contact produced substantial enduring drinking reductions among an alcohol-dependent population. Remember, they were scheduled for 12 sessions. Motivational interviewing was scheduled for 4 sessions. And in general, people only showed up for 2/3 of their sessions. So people were showing up for 2 or 3 motivational enhancement sessions, and then they cut their drinking all the way down. While no treatment characteristics were significant and virtually no treatment patient matches, psychological and contextual traits of alcohol were significant. That's where they were treated, who treated them, and who they were. Treatment outcomes were conceived primarily as a successful reduction in drinking, which is utterly at variance with treatment goals as usually conceived in the United States. They had to gerrymander how they measured success in order to claim it's success. So this is Enoch Gordis, nice guy, gave me those manuals. The good news is the treatment works. All three treatments evaluated in Project Match produced excellent overall outcomes. Match's lead researcher, Thomas Babor of the University of Connecticut, declared participation in any of the Match treatments would be associated with marked positive changes. There you go. Bob's your uncle. You don't have to match anybody. Just get them into any kind of treatment in the United States, as long as there's a 50-page manual. They're videotaping every session. Every therapist is trained to the gills. You're good. Meanwhile, I was one of the major critics. So Richard Longabout, he's a guy I know, wrote in the APA Addiction Server, I am a Project Match PI who has followed much of the correspondence on this list regarding Project Match. Contrary to Stanton Peele's conclusion, the NIAAA is devoting time to refuting Stanton Peele. The results of Project Match are far from concluded. There are at least 2 more papers that should be digested. Only then do I think we'll have sufficient view of the findings to evaluate Match's contribution. I call that the let's wait and see and then vote everything conclusion. After 8 years, everybody had forgotten about Project Match. They came to the conclusion that they came out in the first paper. Nothing really worked. Let's forget about matching. But Stanton Peele shouldn't be commenting on this until we come to this final conclusion. A guy named Robert Cutler's kind of a interesting figure. He believes in genetics of alcoholism. And so he reanalyzed the Project Match data. And he came a median of only 3% of the drinking outcome at follow-up could be attributed to treatment. However, this effect appeared to be present at week 1 before most of the treatment had been delivered. Nearly all the improvements in all the groups had occurred by week 1. You get a bunch of people, they're highly selected, you have the best therapists, you tell them what they're going to do, and they quit or reduce their drinking by week 1. So here's Cutler's summary. The results suggest that the current psychosocial treatments for alcoholism are not particularly effective. Untreated alcoholics in clinical trials show significant improvement. Most of the improvement, which is interpreted as treatment effect, is not due to treatment. Cutler says all that by way, and it's all accurate based on the data. He's saying all that because he wants to do some medical solution.
Right.
I'm in Wikipedia. I'm called a critic of Project Match. Dr. Stanton Peele criticized Project Match on the basis that there was no control group, a group selected specifically for non-treatment, to determine whether treatments were more effective than the natural recovery process. Therapists in Match were more highly trained and monitored than addiction counselors usually available to the public. Effectiveness for all treatments was measured by reduction in frequency and intensity of drinking, whereas 12-step and abstention-based program, he argued, should claim no improvement without full abstention. Peele states Project Match's failure to confirm a matching hypothesis revealed more its oversights in their methods, as well as showing that American conceptions of alcoholism treatment policy are fundamentally wrong.
So, if your AA-based program and your program is help people reduce their drinking, either admit that reducing drinking can be helpful while you're still drinking, or make your conclusions for what success is 0 drinks.
So they're sort of saying, oh, we came up with a new way of looking at things.
Right.
AA stink. You can't do AA. It's reduction in drinking that we're looking at. So the last sentence in my critique in Wikipedia says this, and this is hilarious to me. Non-American research has shown that subjective matching does work. Subjective matching means pick your own treatment. And other research shows that, quote, Many with alcohol use disorder problems heal on their own without treatment. And then you know how in Wikipedia they have in brackets, flag this statement or more research or something like that.
Right.
So it says in Wikipedia, after they quote me, dubious, discuss.
That's good.
So what Cutler believes that medical treatment for alcoholism can be performed. There's an alternative to matching by psychosocial variables. I mean, Bill Miller's a psychologist. So in 2015, there was a treatment study with alcohol dependent studies published in the Journal of the American Medical Association Psychiatry, conducted by a prestigious brain disease model of group led by Charles O'Brien, who headed the Substance Abuse Disorders Work Group of American Psychiatric Association's DSM-5. Quote, the study's authors hope to show the benefits of pharmacogenetic matching. The problem was they were testing naltrexone. Overall, the studies of naltrexone for treating alcoholism have shown no overall benefits. So O'Brien figured out it's because naltrexone affects a specific gene allele. And if we separate the subjects out by what their gene alleles were, we'll find that it's incredibly effective for one group and not the other. In this case, involving naltrexone treatment for alcoholism, searching for genetic differences in patients that make the medicine effective for some and not for others. Naltrexone performed no better than placebo in reducing subjects' drinking with either genotype over a period of 12 weeks as the drug was actively administered. Now I'm going to quote the researchers. There was no evidence of a genotype times treatment interaction on the primary outcome of heavy drinking relapse. They had 12 measures. When did they start drinking? How much did they drink? Did they fully relapse? None of those things was greater with naltrexone with either type of gene versus placebo. A significant reduction in heavy drinking occurred across all groups, that is, with both allele groups and both the NTX and placebo. All right, I'm going to throw it back to you, Zach. What the hell happened in that experiment?
It suggests further what you said at the top. Regarding disease, you believe you're disease, maybe you are, but there's more than that. Like what you believe influences what you do in general. In other words, placebo means nothing. You've turned something on yourself and said, I'm going to reduce drinking. And you did it because that's what you were supposed to be doing.
It's called a double-blind experiment. The patients didn't know whether they're receiving placebo.
Right.
And the treatment people didn't. So, and all of the reduction, remember the Cutler thing finding? All the reduction occurred at the beginning of the Project Match.
Right.
You come in, you're a volunteer. We have a substance we're going to give you that makes you reduce your drinking. Boom. In the first week, they stopped drinking or they reduced their drinking. And then for 12 more weeks, they keep it at that low level.
You're going to reduce your drinking. I am going to reduce my drinking. Right.
And so what we proved, by the way, Charles O'Brien didn't come out and say, oh, this proves that cognitive variables determine everything. Charles O'Brien said, we have to study other alleles. Maybe that'll make the difference. What possible use can we make of this finding? Let me jump ahead and say what you can't do. You're not allowed in the United States of America to say, oh, we've got this magical potion that makes you reduce your drinking. We're going to give it to you and then give them placebo. You're not allowed to do that. That's against medical ethics.
Right. But there is a flavor. I mean, you could call it mindfulness. It's funny, when I was introduced to Ellen Langer's work, there was a question that I used to ask my wife all the time about different kinds of issues and different kinds of medications, and thought, is there an ethical way to turn the power of the placebo back to yourself and say, can I just start believing a thing and make it happen? And that's mindfulness. And I remember one of the first lines that I read of an Ellen Langer book said, it's like taking the power of the placebo and turning it inward, and, latched onto that immediately. So the thing you can pull from it is there's got to be a way, and there's got to be a truth behind, letting people create their own ideas about the reality in an optimistic way.
And how do we do that in LPP?
Well, turning people's attention away for just a second from the worst problems in their lives and the catastrophizing of, because this is a bad problem, it's going to get worse, to you have other parts of your life. Think about your life and what you want and why you could get what you want, why you might not get it, and what power you have to be able to do those things. Alcohol or no alcohol.
Or whatever they're getting.
Sure, right.
Sex or food. And so that question you so insightfully asked your wife, that Ellen Langer outlined, is placebo is so powerful. And this incredibly elaborate study by these brilliant brain researchers simply proved how powerful placebo is. How do you harness that into the treatment process, which in a way is the same thing as Project Matched, whatever Cutler says. If you get people optimistic, if they're motivated, if they want to change, if they feel they can change with the tools that they're given, then you get the most change.
I deal with this question every day in the kid version of this question, child version of this question, where people are trying to teach rote math or reading or writing. And this concept of play for kids, and Lev Vygotsky, the psychologist, said kids who are at play are a head taller than themselves, meaning sometimes kids do shit that they never thought they could do, and they do it usually when they're not thinking about doing it, because they're optimistic. They have some reason for doing it that defies their current schema of what they're capable of in the world. And the way that happens usually isn't read this book. If you keep reading this book and practicing this book, we might be able to get you to the next level. It usually happens like they try stuff and do stuff and they're happy about it and optimistic about it.
Are people going to accuse us of being know-nothing, Zach?
Yeah.
Stanton, Peele, and Zach say, oh, forget all this diagnosis stuff. Forget all of this, naltrexone, all these modern miracle drugs. Relate to the child or the adult. Ask them what they want in life. Review how well they've done in getting there, with the positives and the negatives. Talk with them about how they're going to be able to be successful at what they're doing. Help them, inspire is too strong a word, help them to feel confident that they can do it, believe that they can do it. And the whole point of the thing is, we just want them to do it as well as they can do it. We're not, some people are going to go to Harvard and some people aren't. And some people are going to become really safely controlled drinkers and some aren't. But we're just trying to move the ball down the field in a positive direction. All positive change is greatly accepted. We believe you can do it. Millions have done it before you. And we're just going to say, here's the roadmap for going ahead and doing that. Forget that you have attention deficit disorder. We don't want to go against a psychologist in school, but let's not talk about your bipolar disorder. Let's not talk about your adjustment difficulties. Let's just talk about you, yourself, and the world that you're dealing with. And we're both in this together, and we feel you're going to do fine.
Radical. Funny that's the revelatory thing that you're saying isn't let's be optimistic or let's look at your life at a practical level. The thing that bucks against everything else is saying, from a clinician perspective, we're saying, let's be cautious about the harms that we could do if we do the opposite. If there's some other story that we're trying to, fast track or short shuffle, that could be super harmful. That when you start doing that, that's when people will call you a know nothing.
People start feeding back to you their diseases.
Right.
Okay, when they're an adult, you figure, oh, that's their shtick. You know what I mean? If somebody wants to tell you they're ADD or they're bipolar.
Yeah.
Okay, it's a free country. You know what I mean? I never do that. People can perceive many diseases in me, but I never label myself. But when you do that with a child, it's a sin against mankind,
I'll tell them myself, I've had a couple cases. These are high school students of people who, they swear they're diseased in one way or another. And I've even used the term, I'm doing a ride along in their lives with them kind of, and saying, you know what, you nut job, let's just, I'll take that for what it is. And let's imagine we're doing this thing and you didn't have all that stuff going on. And let's see how far you can get. Let's just see how wacky are you, and that's a weird radical. You got to know someone well enough to be able to do that. But so even with kids,
motivational enhancement, they have some video training things. And when a guy says, well, it's hard for me to stop smoking, they have an example where therapists, oh, you'll never be able to quit. You're obviously a lifetime cigarette addict. The guy says, wait a second. The guy starts arguing with you.
Right.
No way. There's something about you that just makes you mean that you'll never be able to give up cigarettes. People won't buy that about themselves if you throw it at them.
Right. Well, people develop along the course of their lives. Even if the older you get, the more you seem like you're set in stone in some areas. And we are trying to capitalize on that because that seems like a way that doesn't hurt people to explore.
And so to summarize, we've just dealt with two of the major research projects in the history of alcoholism treatment, Project Match and the genetic subclass O'Brien group study of naltrexone therapy. And both of them found that the whole population could improve as long as they were, motivated, given support, and, felt that they were getting some kind of help. Crazy. All right, Zach, we've had so much fun. I guess we're just going to have to call it a day.
And you know what? We should get back together in 150 years when the findings of that study are finalized.
I expect all of my predictions to come true 150 years. Thank God you'll be around.
All right, Stan. Have a great night. Thank you again.